education series. In this segment, we want to instruct you through 4 exercises targeting the muscles of our pelvic floor and our pelvic basket. Consistent exercise strengthening these muscles will give you a better opportunity to remain pain-free throughout your pregnancy, to work towards an easier delivery and a quicker recovery. The first exercise is the 2-step Kegel sequence. This exercise focuses on activating all the different muscle layers of the pelvic floor through 2 distinct actions. The first muscle action is to tighten your pelvic floor as if to stop the flow of urine or the passing of gas. You're tightening the sphincter muscles surrounding the openings in your pelvic floor. The second step is to draw your pelvic floor up into your pelvic outlet, tightening it from its relaxed bowl-shaped position to a higher position that draws it taut like a trampoline. With this action, you're working the deepest muscle layer of your pelvic floor, the levator ani that runs from your pubic bone back to your tailbone. To perform a 2-step Kegel sequence in the sidelying position, follow these instructions. Begin by positioning yourself on your side with your head placed on a pillow or your hand. Bend your knees to 90 degrees with one leg directly on top of the other. Your shoulders, hips, and ankles should all be in a straight line with your knees bent out front. In this position, first perform a Kegel contraction by tightening your pelvic floor as if to stop the flow of urine or the passing of gas. Hold this Kegel contraction as you begin to elevate your pelvic floor up into your pelvic outlet. Imagine there's a string attached from your belly button down to your pelvic floor and you're attempting to pull it up. Keep pulling that string up for a full 8 count. You'll feel your belly button draw in as you pull your pelvic floor higher, and that's okay. That's your transversus abdominis muscle coordinating its contraction with your pelvic floor. At the count of 8, release your hold, relaxing your pelvic floor down, allowing yourself to take in a deep breath and release, relieving all the muscle tension. Now we will follow with 4 quick flicks or 4 quick Kegel contractions. With this action, you're only tightening the muscles around the openings of your pelvic floor as if you don't want to pass any urine or gas. These are quick contractions with a quick release to a rhythm of tighten, relax, tighten, relax, tighten, relax, and tighten, relax. These quick flicks isolate the sphincter muscles of your pelvic floor so your back shouldn't move and your legs should remain in the same position, bent at 90 degrees as when you started the exercise. Great job. That's 1 complete Kegel sequence consisting of a pelvic floor elevation followed by 4 quick flicks. As a women's health physical therapist, I recommend you perform 8 complete Kegel sequences each day to maintain good tone in your pelvic floor muscles. You don't have to perform all 8 at once. You may notice that your muscles fatigue too quickly, so you may benefit more from performing groups of Kegels throughout your day. Keep in mind, the key to successful rehabilitation of the pelvic floor is not quantity, but consistency.